partnerships to build a resilient health system for India.
Unlocking greater capital through partnerships and strengthening health systems leading to results on the ground.
Driving a sustainable model to catalyze market solutions for healthcare.
Scaling and high impact are the hallmarks of this unique program.
Making quality and affordable healthcare accessible to everyone in the country. There have been consistent efforts at making the Indian health systems both resilient as well as strong. There are, of course, inherent weaknesses in the system which still exist. 2017 Health Policy of India declared that we would ideally be spending 2.5% of the GDP on health. The government spend is limited to 1.3%. Private spend is also not very high.
Companies in this sector find it very difficult to raise funding, and the primary reason is that it is capital intensive and requiring long gestation periods.
Many a time, startup businesses and innovators are not able to attract commercial grade investments. So this could be due to perception on the healthcare sector being risky with uncertain returns.
In March 2020, COVID-19 was looming as a global threat, and community transmission in India was accelerating. Working with IPE Global, we recognized the need to be creative and harness the incredible ingenuity of India's private sector, the commitment of Indian government institutions, academic research, and the resources of the finance sector. USAID brought our rich experience with innovative financing in India to this collaboration to develop SAMRIDH, a facility which combines public and philanthropic funds with commercial capital to scale proven market-based health solutions. These solutions reach the most vulnerable populations. The dedication and commitment of our partners has led to practical solutions such as hand-crank defibrillators, new cold chain technology, using drones to bring healthcare to inaccessible communities, and many more.
At SAMRIDH, we think that blended finance is a game changer. Our team works closely with healthcare facilities to understand their needs and helps them structure finance. So we really give them a combination of debt, equity, as well as philanthropic grant capital. The idea is to really give them concessional capital and to try and mitigate their risk through grant capital, through philanthropic organizations. And once the risk has been mitigated, then the commercial entities come in and are happy to fund those projects. We've been able to raise a lot of philanthropic capital through players like USAID, through Rockefeller, and raise debt capital through Axis Bank, IndusInd Bank, Caspian, and a number of other players.
The commercial banks need someone to support their risk. The development finance institutions or the philanthropic agencies come here with a view to get better leverage and higher impact. And the borrower comes here to get access to cheap funds. So the coming together of these diverse players in a collaborative fashion actually becomes a very win-win sort of a platform and very unique in India.
SAMRIDH helps us identify innovations, mobilize capital, provide technical advisory in particular to help take these innovations forward.
Through SAMRIDH, we have already forged over 100 partnerships with an initial grant investment of $12 million to 30 plus entities. We have been able to leverage in excess of $100 million.
It has managed to reach 1,000 plus healthcare facilities, 17,000 plus medical staff, community health workers and nurses, and impacted 25 million people. What SAMRIDH is bringing into play is filling in the gap which resulted in denial of access.